Okay, Commissioners, we're back. Next, we have County Fiscal Year 2015 budget request, and we have Ann and Parth here, and I'm just going to turn it over to you.
Okay, thank you, Commissioner Poole. We are here again for the third night to talk about the Fiscal Year 15 budget request. We have a few departments here to talk specifically about their budgets. Well, one in particular, transportation, human services transportation. Thereafter, there will be some fee change requests coming from construction standards, planning and zoning, and emergency management. So those are the individual departments that we'll be presenting tonight. But first, we'll start with human service transportation.
Good evening again. Thank you for this opportunity to come talk a little bit about the transportation budget, as we definitely are seeing some changes in this world of transportation that we deal with daily. As you are aware, the Transportation Department relies on several grants that we get from the state that have federal and state dollars in them, that we provide a variety of services under these grants, and they support our operations, they support our capital, and other factors, and there's been some changes in these grants that we've had to address. The grants are now changing and evolving to the point where we're either not able to use them as they have been designed, or they are just going away in some cases. So we have tried to be very proactive, and Bob's been very busy working numbers, trying to look at ways that we can deal with these changes to first try to minimize impact to services, and then try to look at other revenue streams that we can maximize to help offset these cuts. And that's been the challenge that we've had, but I think we've come up with a pretty good plan. With these changes in these grants, there is no doubt we will see impact to some services. So we've tried to keep your priorities in mind when we've dealt with redesigning our services, to make sure we're providing the necessary transportation that you've considered important through conversations we've had with you, and help us prepare for future efficiencies as well. We are realizing some savings through this process, which is always a good thing, because we always want to be good stewards of the tax dollars. But we will see impact to services, no doubt, both in what we can provide now, and then, of course, expansion at a later time. What we have done is we've prepared a brief PowerPoint for you. I think Bob and Tom are going to kind of go over that and talk to you a little bit about specific changes that we're seeing with the grants, what the impact is to us as an agency, and then what we're planning to do going forward in the future. I would like to thank Parth and Shelley Ferris, who helped us put this PowerPoint together as well too. So I'll turn it over to these guys to talk about that, and then we'll be happy to entertain questions on this or any DHS service that you have a question about.
Okay, so the driving force behind these changes is the federal MAP 21, Moving Ahead for Progress in the 21st Century. Has specific guidelines for our federal grants. Along with that, the latest census has moved us into the large urban category as far as transportation is concerned. The impact on that, in the past we've always operated under a small urban and rural, and the grants that are impacted, the 5310 EdTap, which expands transportation services for seniors, and the 5316 Job Access Reverse Commute, those grants are designed for small urban and rural. Now that we are large urban, we are not able to utilize those grants the way we have in the past. Basically, anybody that rides under these programs would have to live in the rural area. An example is under the 5310, I did some research, and there would probably be 3 clients that currently ride under that would still be qualified to ride, and there's 3 drivers attached to that grant. It just doesn't work. So we move to our adjustments. We have a change in landscape, and we want to maximize our service demand with the limited funding streams that we've had. Tom and I sat down in December before we knew any of this information and started working on our budget, going through each line item, looking at 4-year history and trends. And then we were presented with these issues from the state, and we sat down and really challenged each other and said, how can we get the most for transportation with the changes that are coming? So the plan we have come up with is between the two grants, the 5310 and the 5316, we have 10 drivers, 3 for seniors, 7 for the JARC or links. Our plan would keep those drivers, even though we're going to do away with the grants, make those county drivers. If we did this, we would be able to continue to do the Cabarrus vocational trips that we're doing now with the links, taking the clients in, and taking them home. We'd not be able to increase it, but we would be able to continue at the current level. We would also be able to continue our current senior trips that we're doing with the 3 drivers. Again, we would not be able to increase them. We would have to stay where we're at now as far as level of service. Then the plan is to take those 10 drivers, the links drivers, for example, after they drop off the Cabarrus vocational, instead of running the routes, Mount Pleasant, Midland, Harrisburg, we're going to put them directly on our Medicaid trips that are currently on the taxi. Let them do those trips in place of the taxi. As you can see from the next slide, the JARC grant was going to go away next year anyway, whether we kept it this year or not. It's being rolled into a 5307 grant with the federal government. So we're trying to be proactive. We did get a slight increase in the HCCBG grant that will help cover the cost of the senior trips, so we can maintain those current levels. What it amounts to when all this is said and done is the Medicaid taxi line item, which is currently $380,000 a year, we will be able to cut down to $82,000 a year. And we have done some internal structuring as well. Ben may want to.
Yeah, I can definitely talk to that. Through the consolidation process, of course, when we first did it with aging and now with transportation, we tried to look where we had duplicate administrative services going on and where we could actually consolidate those and hopefully save positions. And we were able to do that in transportation with the transportation department had a fleet management position. Well, DSS, on that side, we had a facility person that managed our fleet as well. So what we decided in the end, and we actually pulled this off in, I think, December or January, is we consolidated those 2 positions into one. We had a retirement in the DSS side, so we didn't fill that position, and we just took the position in transportation, merged those 2 positions together, and had one position doing all the fleet maintenance for both transportation, CCTS, and the DSS fleet that we have. We have a fleet of about 25, 26 cars. And then in addition to that, they were doing facility management as well, too. That position now has actually been rolled into general services because, you know, personally, I'm not an expert in that area. That's not my expertise. So really what they were doing, the functions they were doing were more general service related functions. So general services actually supervises that position now, but we were able to eliminate a position through that. And we're looking at other efficiencies as well, too. The call center is one area that we want to look at. They have a call center, DSS has a call center. Now, they do 2 totally different things. So that's a little more of a challenge, but we are, you know, committed to trying to see if we can create some efficiencies there as well, too. But through that, in addition to that, when we had a vacancy in the director's position, we actually consolidated the director and Bob's position, which was like an operations manager, and just created one division manager, which Bob has that position, and he has 2 supervisors, Tom, who's here, and Franklin, that basically manage drivers and some of the dispatch. I think Bob maybe supervises some dispatch call center people as well, too. So we were able to actually reduce the position there as well, too. So we've really tried to focus on where we can get savings and efficiencies and run things more economically. We've tried to do that, and we've been able to do that so far with consolidation.
So the major changes due to the grants going away in FY15, we were able to use our current drivers and maintain the same amount of FTE to provide better service to our customers, excuse me, and rely significantly less on taxi service. Then if you look at what this does to our budget, you notice that the revenues have gone down without the grants, but our expenses have gone down even more. So the net county cost, you can see, has gone down $158,000 from this year to 15.
And by shifting drivers, the 10 drivers that we've talked about, by shifting them to Medicaid services, again, that's a reimbursable service that we get, as we discussed earlier. So that's revenue that we pull down. In addition to that, they're able to still provide other trips that we now, because we have a shared, what's called a shared transportation system, where they're providing, you know, they're just not driving Medicaid trips all day. They're driving a variety of trips, aging, Medicaid, employment. So we're able to tap into a new revenue source with our drivers, to kind of supplement that revenue source we're losing with the 5310 grant and the JARC grant. In addition to that, we met last week, Ann was there, we met with the DHS fiscal consultant, and we're looking at making sure that we're not missing any other opportunities to claim reimbursement for drivers and administrative staff. Transportation, again, has always had these grants, so it's a little different, but when we've consolidated now with DHS, we actually send a report to the state to get reimbursement for all the traditional DSS services. Chris is familiar with that. The 1571 is what we call it, but when we submit that report, we have to still report transportation because now we're under one roof, but we're not getting reimbursement from that system. They are solely dependent on the grants and the Medicaid funds. So we want to look at that with that fiscal person, make sure that we're not missing any revenue there as well too. If we can tap into additional revenue, or we can find a more efficient way to do it versus just doing straight billing to Medicaid for a per mile, basically a per mile cost is what we bill to Medicaid. We'll take a look at that to see if we can maximize even more revenue. But for now, you know, that's the way we're set up to do it. And we've, through these efficiencies, we're able to save some dollars and still maintain 90% of what we're able to do. We do lose some, obviously with the JARC, we lose that service there as well. But, you know, that was going away next year anyway. So we decided just to be proactive and say, where can we best use these drivers in the future to maintain the priority trips that we want to do with senior and the vocational trips. So
And
with that.
Just to add real quick, JARC is Job Access.
Reverse commute.
Okay, so we had some discussions a while back. This is the door-to-door pickup. That grant is going away, so that will be a negative impact on that. There may be some of those that we can pick up under the rope.
Rope, that's correct.
But there will not be any fixed routes, correct?
Correct.
So that's a negative impact of this. There is no, if you think it's a negative impact, that's a negative impact there. I just want to make sure you guys are clear. Is there anything other than that going away? We can still run the service to the job center.
CBO, yes.
Yes.
Yeah, CBO.
This plan does.
We do maintain.
We'll be able to, again, reduce our output on taxis because we're going to run it in-house. We think we know we can run it cheaper, and we think our customer services is going to be better too. No offense to those companies. They do help us out tremendously, but we think we can do that in here, pull down less federal money by doing so. We can maintain our elderly service, and we can maintain the CBO. Just want to make sure there's no time bombs out there that you're going to see or
But
something
I think
come
the
up
key
because
word
of the
there is
negative.
maintain. You
Yeah,
know,
that maintain, yeah,
expansion
so.
is not in the future with this because with the 5310 we were able to expand some senior trips, but we're, you know, with the restructuring of that, we've lost that ability to expand, but we will maintain mill sites and those kind of things as well. And of course, we did get some additional funding under Home and Care Community Block, and I think Commissioner Osterwright was a big part of that, so thank you. And it lets us, you know, it gives us a little bit more funding to help with the senior trips.
I have two questions. On the CVO, you said you can maintain. If one client no longer needs the service, can you fill in with somebody from a waiting list so that it's the same number of clients being served? Or if somebody no longer needs the service, it's just nobody else gets assistance.
If there was a client on a waiting list in that same vicinity where it wouldn't affect the route, we would be able to do it. If somebody dropped off a Kannapolis route, we couldn't add somebody in Harrisburg unless somebody dropped off to Harrisburg. So yes, it can be done depending on where they live.
Okay, so there's a possibility that you could, if that happened, you could trade something out?
Yes.
Okay. The other thing that, on the taxis, I just wanted to, that's great to go from, to have such a decrease. Is there a guaranteed minimum that those companies would receive, or is it just, if we use you, you get the service, but if we don't, there's no negative to us by not using them as?
No.
Okay. I just want to make sure there wasn't a guaranteed
No.
minimum, whether we use them or not, we had to pay them a flat fee or
No,
something.
they're reimbursed strictly for the trip.
Okay, good. Commissioners, I'll open it to any of you for comments or questions.
Just have a question. What will you do with the JARC vehicles that usually run the route? You can
We
use
still get,
those?
yes, we get to
Okay.
keep those.
Okay, great.
My top priority amongst the services that we're losing is to maintain the CVO. That's a tremendous program out there, and if anybody's worthy of a transportation, it's those young men or all men and women that they work tremendously hard. The director out there told me that on snow days they're disappointed that they don't get to come to work, and if all of us, me included, had that work ethic, I think our county would look a lot better. And so you said 7 people of the 10 will go to CVO. Is that right?
Well,
In the morning?
The current drivers that are transporting CVO will continue to do so.
And that's 7 drivers?
Yes.
Okay. And they will go and do the Medicaid trips also?
Yes, after they drop off in the morning, then they start with the Medicaid trips until they pick them back up in the afternoon.
Okay. And now the other 3 will go over to the senior side?
They will continue to do the senior transportation. They're doing now the meal sites and medical appointments.
So I don't have the exact terminology, but I remember when we were looking through these grants in October that we had started these programs out with this EdTap doing medical trips. I think there's an exact term. And there was a waiting list to do medical trips, and then we had expanded and cleaned that waiting list out so that there was no waiting list. And then we moved into these secondary type trips that are non-essential maybe trips, and there had been a waiting list there, and then there was no longer a waiting list for that. So of those 3, how many are required to fulfill the medical trip element of those 2 categories?
Well, the 3 drivers were not able to do all the trips with that grant. We were still having to use some other drivers to fill in the gaps. They were doing the meal sites, 3 of the meal sites, and then the special trips as the grant was designed. So with the new plan, of course, special trips are not going to happen. It'll just be meal site and medical. So they'll be able to continue with the 3 meal sites. They do the 3 largest meal sites. We still have one in Mount Pleasant that another driver has to do because there's only like 2 people that participate. And then they will do nothing but medical appointments.
Okay. So it's going to be meal sites and medical only for those 3 drivers?
Yes.
Okay.
And as Ben was saying, we do a shared ride. So like the 7 drivers, if they're coming across the county with 3 Medicaid clients, it doesn't mean that's all they can pick up is the 3 Medicaid. If there are clients, aging clients in between going to the hospital or a doctor, of course, they can pick those up as well. So it's kind of just depending on the timing.
Anything else? Okay. Thank you very much.
Thank you.
Next is construction standards. So Kelly Sifford and maybe Scott DeVoe.
Thank you. We wanted to bring forth to you some numbers to look at and make some decisions. What we did back in the fall with Parts Help is determine exactly how much it costs per hour to put somebody out there. You see kind of the breakdown of all the things that are involved with that, from salary to uniforms to training technology support, all of that. So we determined that to be right at $86 an hour. And that includes vehicles, by the way, gas and all of that. So what we did is we looked at how many inspections for each type, and how much it was costing the county to get there for those inspections, and how much we were currently charging. So on the left-hand side, you see the current permit cost. We did a 2.5%, 7%, 10% increase. It shows you the number of trips and the total cost incurred by the county for each type right now. And below you have a list of the type of inspections, or for each inspections requires, assuming again that there are no failures in this. This is just the basic number of inspections. So we wanted some guidance from you about what direction to go. Personally, I would recommend the 10% increase with a minimum of $40, which is basically half an hour of time, because we really can't get to a site at all with any less than half an hour. But we wanted to bring it to you to make some decisions about how much of the cost you wanted to recapture. Just to make clear, we're not running in the red, because we do have larger projects that somewhat offset all the residential. So we aren't in the red, but this is what it's costing to provide that service, and so we wanted you to be aware of what it's actually costing, and then how much of that you wanted to recapture. Are there questions?
Commissioners?
Do you assume an hour for each trip?
No, I don't know if is the second page on there. We assume 50 minutes for a typical building inspection, 30 minutes for a plumbing inspection, 40 minutes for a mechanical inspection, and 60 minutes for electrical inspections. And that is based on what our inspectors have been doing and what should be done at each inspection. That's how long should be spent, with obviously a typical inspection, and that varies tremendously on building size and complexity and matters like that.
So even with the 10% increase, we're still going to lose $35 to $40 per permit based on these?
Yes, the building permit is actually, I think, probably the closest in line. What's really hurting us is the trade permits. Those are pretty low compared to what it takes to actually carry out the inspections. Mm-hmm. And also, we did consult with the Home Builders Association about this. We've asked for comments a couple of times, have not received any comments one way or the other. So we sent them this very document to look at to see, what our costs are, and did not receive any comments back. So
the entire process, when you add the trades in, even with the increase, we're still losing about $350 per home.
Yes, and keep in mind, the fees have not increased in a number of years. Mm-hmm. So, as other costs have gone up, whether it's fuel or training or whatever. And one thing to consider too is our training costs have stayed somewhat like they were when we had more employees, because we've gone to a cross-training so that they can do more inspections on one site, so that individual inspectors have more certifications than they did in the past, which means they have to maintain those trainings. So we really end up with almost the same number of certification requirements that we support that we did before.
Right, which they have to travel sometimes.
Sometimes they do their best to stay, day trips, and sometimes drive quite a long ways to do day trips with groups of them. Mm-hmm. But occasionally they do have to spend the night elsewhere, but we do every free opportunity we can find. Unfortunately, in the realm of building inspections, they don't provide a tremendous amount of free opportunities.
Right. How does this place us with the counties around us that we compete with?
Well, we did look at that some, and we are a bit cheaper than most of them. but I didn't put a whole lot of emphasis on it because I knew we had our actual cost.
Right, right.
But we are a bit cheaper than our surrounding for the most part.
Great. Thank you.
Kelly, I remember when you brought this to us the first time that we were talking about you having to make multiple trips and things like that, and I could be wrong about this, but it's my recollection that the original fee structure that you brought to us was somewhat higher than what you're proposing to us tonight. Is that right? It was a while ago, so.
That was actually just for the callback fees.
Uh-huh.
And I think we've experienced a pretty good drop in callback fees since we instituted that policy, and that was really just related to that. So the only time we charge a callback fee is either it's locked and we can't get in. There is it's just clearly not ready for inspection and they knew it. Those kind of really egregious things. If it's, we walk by and find two small things, we don't charge a callback fee for that. So that was really just related to callback fees, and that was all that was. And so those fees, they were I think probably a little more steep, but they're, designed as a deterrence to calling us out when they're not ready.
Okay, thank you.
They've worked really hard on this. I think I've put a lot of pressure on them. Okay, what about this? What about this? What about this? But the biggest thing is this department pays for itself, and in order to do that, especially if we're going to meet the demand, if the residential continues to grow, we're going to probably have to add some additional inspectors on in the future. This will help us pay for those inspectors without having to use general funds. So.
Yes.
I don't remember the last time we had a fee increase. It's been
I think it may have been 2008, maybe before. Yeah, it's been a long time.
So it's been a while. So I did ask them to go out and reach out to the building industry, and they did so. And we've not gotten any feedback or one way or the other.
Well, the one piece of feedback we got is that when we reached that point where we were behind in inspections and it was taking multiple days, that was costing the industry money. And I think the feedback that Kelly and Scott have been getting consistently is they want us to continue to do next day inspections and to do what we need to have the staffing levels that we can do that.
Yes, and we actually lost an inspector recently. He hasn't gone off the job yet, but as soon as he did, we started getting, you are going to assign somebody to our area, you are going to assign, so we know that they, especially moving into the summer season, they are really expecting us to make sure that our staffing is appropriate. So this will help us moving forward keep our staffing levels at the right place, we hope.
I think I've mentioned this before, but one call specifically that I got last year when we were a little behind on some inspections and y'all were in the process of staffing up, the person's comment to me was, you are not paying your inspectors well enough. You need to pay them more because you're losing good people to surrounding counties, which is not something that you frequently hear from folks, but you're right, that costs them money when they can't get efficient service. So I can understand what you're saying.
And it costs us money as well when we're training them and then sending them somewhere else.
Right.
So, we would like to get in a position where we can retain.
Hey, this is part of the regular budget, though it's not a separate item. It'll be in our budget.
Right. What we were really looking for is some guidance on the amount that you wanted to see. Like I said, we've made a recommendation of 10% or with a minimum flat fee of 40. I mean, we have a couple of permits that are like $15, and we can't even get to the site for $15. So we wanted your guidance in how much you wanted to recoup from that.
Does anybody have any concerns about this? If she wants to get some indication, it's your area, it's not my area, so does that seem logical to you, Larry?
10% is not that much of an increase.
Okay.
It hasn't been done since 2008.
Steve,
Has houses
Chris?
increased since 2008?
What's that?
Has the cost of houses increased since 2008? Huh?
I haven't bought anything, so I guess it depends on where you live. I don't know. But I don't know about new construction, so are you okay? Chris, are you okay, or do you have questions?
I mean, yeah, I would rather look over this a little bit more in detail, and then maybe I can email in, or if we're going to discuss it at the next meeting,
Right,
I'm
we'll
not sure.
discuss it at the regular meeting as part of that process,
Yeah.
I would think. But
Right.
just, if there were anything just that sounded terrible, I wanted to give you a chance to give Kelly
I'd just like
kind
to
of a
look
heads
over a little
up.
bit more.
I wish we could hear from some building industry people about this. I imagine if you were doing a big subdivision, I mean, you could potentially add 10% onto your permitting fees, and that could be pretty expensive for you. And the only concern that I have about 2008, I mean, if you think about the market up to 2008, it was really a booming housing market whereby we had a lot of demand and people were spending money pretty easily. So potentially it could be that our permit fee was at its all-time high in 2008 and the market really dropped out, and that our fee is maybe still appropriate because there was so much demand in 2008. And I don't know if you have that data or not. I would really just like to hear from our building industry. I hate that we continue to talk about these things that really impact a lot of our businesses, and we don't hear anything from them about it.
Did you send it to Ann Cronella and CCBIA?
Yes, we met with them, we discussed it, we told them we would be sending it, we sent this document and did ask for feedback, and she said she was waiting to hear back from additional people, and we have not.
I got a couple people I'll try to get up with this week and that have been big volunteers that I know. So I'll try to reach out to a couple of them and see if any of them are willing to go on the record. How's that?
Yeah, the 10% doesn't seem unreasonable to me. I think there's some unique factors between the housing market from 2005 to 2008 to 2014 where we are now, and I would like to just make sure.
We can try to pull some permit numbers. We switched systems in between, so we can't go back on the system we have and pull how many permits we were issuing at that time. But I think about 2008 was when we started using that system. So we've got 2008 to now, annual amounts of what we were pulling, and of course it dropped off and it's heading back up, and we are consistently hitting 800 to 900 and have done 1,000 inspections in a week in the past 2 months. And even during some of the bad weather back in March, we still had a lot of permit revenues. The inspections obviously were down because you couldn't do as many, but the people were still doing business. So I don't know if they were getting ready because they knew spring was coming, but we have not seen a drop in the business side at this point.
We can reach out to Ms. Cronella again and let her know that the public hearing is coming up in 2 weeks, and that they, if they wish to come speak, that's.
And we'll be happy to do that.
Yeah.
And can you, whatever you sent last time, if you sent an email, could you send that document? I mean, not, because I don't want it all as part of this whole document, but just this part of it, and I'll try to, there are a couple people I'll try to reach out to and see if they can give us any feedback, and let them know that they can come to the meeting if they want to make a comment, and we'll see if we can
Be happy
get
to
a
do
response. Yeah.
I would love to get some comment before we move forward.
Anything else? Okay, thank you.
Did you have any questions on the planning and zoning?
Oh, I'm sorry. You want to go to that one? I'm sorry, I
Yeah,
was looking back
Susie's
over here to
here,
see what
and
else.
Also,
Go right ahead.
Bobby's here if you have questions. I think theirs is kind of together potentially. Those are things that we've kind of been doing for years, that there were no fees or changes in those fees. These things are a little harder to put together cost for, so we did use more of the model of what are other agencies charging for these services. Because they aren't necessarily, a lot of planning items, as you all know, are not necessarily time involved. They could be 5 minutes or they can be 5 days. Sometimes you aren't sure. So these are prices that we got after coming and kind of consulting our neighbors about what they charge for these fees. If there are any questions on these, I'll be glad to.
This would be a part of the budget document also?
Correct. And these weren't kind of, we made proposals more based on what others were doing. So these are actual numbers, not percentages like what you saw on the other document.
Anybody have any comments or questions about anything specifically, or just, I think, to say again what Chris just said, he'd like to have more time to look at the previous one. This is a lot in these
It is.
pages. I'd like more time to be able to look over them. I don't know that I have a up or down comment on each of the line items at this time, but
And
was there
we'll-
anything that jumped out? Larry, I'm not really trying to pick on you, though I am, I guess. It's your industry, I mean, you're in construction, and I don't know if you have anything that jumped out at you.
Housing, I have very little to do with. I'm on the commercial side.
True. Anything at this time? If not, then we'll just, if we have any questions, why don't we, any comments or questions you have between now, if we can get it to Kelly prior to the meeting, so she'll have a chance to respond, and
Absolutely.
then we'll all have some idea if there's something that jumps out on a line item that you are concerned about, so. Or if you question, why is it based on City of Concord versus, or City of Statesville, just to pick one in the list, versus City of Concord, something like that. If there's something that you have a question on, we could get those to you.
Absolutely.
Okay, thank you.
And the final person that we had was Mr. Bobby Smith from the Emergency Management Department.
Good evening. Likewise, our fee structure had not been updated in a while, and our fire marshal, Stephen Langer, worked with Parth to look at some actual costs and looked at updating our fee structure. As you can see, there's not a great deal of change in those structures, and we are still below regional and some of our municipal agencies actually in this county. We're still below that, but we felt that this was a recommendation to try and capture some of those actual fees, permit fees that our folks were doing. Again, we don't do the volume of inspections that building does, but we do maintenance inspections that there are no fees for those that we have to by state law get in the schools twice a year, and then other businesses once every 1 year, 2 years, 3 years, based on the type of businesses. But these fees are kind of capturing those specialties and those construction permits that take the extra time to do. So again, I know you probably need time to look over that. If you have any questions, please email me or call me, and we'll try to address those for you next meeting.
Anybody have anything tonight that you want to ask about or point out? Okay, then we'll do the same. If there's something that jumps out at you before our next meeting, if you'll let Bobby know, then he can respond and make sure we have any updated information that you have. There's just 3, it looks like, increases, and then you've got 5 that are new fees
Yes,
that
ma'am.
you're proposing. So. Okay,
All right. Thank you for your time.
thank you. Parth, do you have anything else at this, or are we going to go over this document, or what are your plans?
So with that said, that's all the presentations formally from departments. So you heard from Human Services, Transportation about their budget, and then from Planning, Zoning, and Emergency Management on their fee schedule. The rest of the time was to discuss the remainder of the budget. All the department heads are in the room if you have questions for particular or specific department heads. And also, yes, there is that question and answer sheet that we passed out a little bit earlier. I did put a single sheet with that fund balance estimated number that Ann spoke about a few minutes back with us as well. I'm sorry for not including it in the packet. But beyond that, I think really the floor is yours to ask questions, and we'll do what we can to get you the answers right here, right now, and also to help you set the budget up.
And if Parth will go ahead and put up the budget changes. Since we've given you your budget document, as early or as late as this morning, we made one change to the elections budget because there's not going to be a second primary. But these are some of the budget changes that we have made. We were unable to complete the evaluation of purchase services and service contracts prior to putting the preliminary budget, so you will see some adjustments related to those line items. And there'll be other adjustments that can be discussed. Some of the JCPC information is up there also, but I think Parth and Ann can go over any of the changes that are on there, but these are the proposed changes to the budget that's been presented to you that are not inclusive in your big, thick document, including the information you asked about the Health Alliance.
And do we have a copy of this?
No, you do not.
You will.
But we can get it, yeah.
Okay.
Tonight.
You can email it to us, or, okay.
The layout is such that you have at the top, you have the general fund proposed budget, as you've seen over the presentations and in the budget book. And I'll come back to this very first column where it says Board of Commissioners contingency. Just skip down to the rest of the lines where you have, again, as Ms. Dubois mentioned, all these different changes that have occurred. Some are revenue, some are expense, and that then is a net change right now at this time is 41,545. We actually had more expenditure changes, meaning there were more things taken out of the budget, so that's why there is a $8,077 increase to the contingency. That's how much money opened up, essentially, and so we increased the contingency by that much. And that, of course, is for you to decide upon. You'll notice that there are these other tabs for the other funds. There were some other changes in the other funds. For instance, in the landfill, as we mentioned before, there were 2 positions. The money is there. They just are temporary positions, so they need to be converted. There's no dollar change there. And in the 911 system fund, the state just got back to us, I think it was late last week, and the budget decreased by $56,000. But of course, that is a expense and revenue change, so they still balance.
Is it only changes to other funds?
Yes. So I think Ann was going to maybe go through each of these one by one, if you'd like.
Right. The first item relates to the service contracts for the sheriff, and when we got to looking at that, we needed to include $790 in expenses, but we needed to include $13,345 in revenues. So that one was a good news information, and those relate to revenues that will be coming from the city for the radio reimbursement. The next items relate to JCPC updates. When we originally did the budget, you know, we put the amount of funding in, but we don't know who's going to get it, and they have met and done their allocations, and so those items were.
It gets changed again too after that.
He said he thinks it's changed again, but basically that is just deciding based on what they say where that will go to. So that one has no net effect in terms of the general fund and what we would be spending. The next item under tax collection fees, Harrisburg Council voted for us to do their tax collection, and so that will bring in $28,000 in revenue, and there won't be additional expenses because the bill was going anyway, the postage was going anyway, so that's just government being more efficient. I was pleased with that. The next item is one that did kind of hurt. It was $47,053, and this relates to that tax and tag together. They changed our fee structures. In fact, we get letters now that say we're going to go back to March or November and retro bill you, et cetera, et cetera. So the way it looks right now, it's going to cost us $47,053 more than we had originally budgeted based on what they're doing. And that's one of those things where we get a letter, they tell us what we owe. So it's not something we can do a whole lot about. The next few are service contracts that relate to shredded. Small amounts, $180 a pop for several of them and $540 for another. And then there's a reduction in some shredded contracts at the Board of Elections, you'll notice, and emergency management. We had some savings in a service contract for waste reduction of $3,000. Looks like we altered a transportation contract related to first aid and saved $200. The library system got a reduced rate for maintenance machines, saved $108. Tax administration felt like they could deal with less audit services expense, and so they said that we could cut that 8,000. The next item is the biggie. The other night in the meeting, we were talking about the school nurse program, and they have got back with us regarding what it would cost to totally fund the school nurse program. And we had already funded $56,000, but what they want is an additional $283,024, and that would cover the total cost. No, that's over and above. It's over and above. And so we started looking to see, you know, if you were to think you wanted to do that. Oh, I'm sorry. I can't believe I need a mic. And so there were a couple of places. It's amazing how things work. We're sitting there in this quandary, and Carol Sauls calls and says, you know, we just determined that we will not need a second primary next year. And so she offered up $120,000 in her budget related to elections. So let's go back to it.
Right here.
Yeah. So you'll notice on there the $30,000 coming from the auxiliary employee line and $90,000 from the elections expense line. So that helped us offset the 283. And then there are some funds in the capital reserve fund that we could use to purchase the chiller for the government center. It's $165,000. Right now, it's in the budget to come from the general fund, but we could make it come from the capital reserve fund, save the general fund $165,000, which could go towards these nurses.
The itemized number for the health department is, everybody has their copy?
Yes, everyone has their copy.
Is that in the Q&A?
That one, right?
Which page?
And that's on page, I believe it's on page
Oh, we had
7.
that in their request on Thursday. Is that the same? Has it changed? any?
Pretty much the same. It's on page 19.
Yeah, that would make their total increase $339,952. The PRN sub-nurses would be $39,109. The nurse that they referred to at the meeting the other night was what we called the floater that went between Mary Frances Wall, the Early College, and the Glenn Center at $59,252. The 2 nurse supervisors and an administrative assistant for $218,326. And then there's a laptop of $1,700, increase for fringe for school health nurses of $474, and a salary increase of $21,091, totaling that.
Mike, that includes all the requests, and the 56,000 turned into 59 today.
And that's for?
Floater nurse. The nurse for Mary Frances Wall Early College Glenn Center is now 59, 252.
And originally in our packet, it was a school nurse supervisor at 56,9 something. So the numbers changed a little, and exactly what it was changed a little. The 218 is what he said he spent of the 300,000. He said 218 went to the school program, unbeknownst to us at the time.
It was 59,252 on last Thursday, but when they originally gave our request, when we were building our budget, it was 56. So that's where we got the 56 number from.
You said the 218 number from the 300,000, is that from the one-time contribution from last year? Okay. I didn't think that was intended for school nurses. I thought that was to cover Medicaid expenses.
I don't want to word this. At the time, I think we all thought that it was going for something else, but Sue Yates assures us that it was used to pay $218,000 for these school health nurses.
Okay. Although it was directed to be used to cover the shortage from Medicaid. It was used for other purposes. Is that, yeah.
My understanding at the time was that other sources had been cut, and that they had just found out about it. It seems
Right.
like the day of the meeting, he was like,
Right.
man, I just found out I got this cut.
I remember clear.
And so we said we would do this one time to give them time to adjust.
Right.
Pam, you talked to him. Can you explain? We mentioned last Thursday, Pam spent a long time trying to get this school nurse thing figured out. And the way that I understand it is that when all of that was done, he didn't speak up and say anything about the supervisor positions. And they were not included.
Right.
I don't know, and Pam, I didn't have the conversation, but Pam, do you want to?
The two school nurse supervisors and the administrative staff member were never given to us when we asked for the complete cost of the school nurse program. My understanding on the $300,000 was because they did not get the Medicaid, that they were in arrears, but it appears that he may have been using Medicaid money to cover those supervisors.
Right. And yeah, I know it's been tricky in the past with the school nurses and how they're paid, and we've went through that a couple years. But whenever we were having the discussion about the one-time $300,000, school nurses never come up. So, okay, just what I need to know.
So
Thank you.
today we got the complete detail of all the positions. We verified it back, reconciled it back, balanced the school nurse program, and based on what we were provided and told that was going to the CHA board tomorrow night, this is the request if you wanted to fund 100%. And that detail is posted on, I think Parth said page 19, and that does include a 3.5% merit increase.
I agree with you 100%. I just think that we tried really hard to get that cleaned up, and to the best efforts of Pam and everybody from here working on it, you can only
Now it's more complicated.
do with the, well, I don't know if it's more complicated, but he kind of shot himself in the foot if he was using Medicaid money, and we said very definitely last year we wanted to try to get it all there so we could identify it, and so that it's a line item for that purpose that can't be cut.
Right.
And so I think that's where there was some, I don't know, I won't say there's I don't know, let's say confusion. For some reason, we didn't get the whole deal.
Well, I don't think there
But
was
I
any
agree with you.
confusion. But
I did have I hate it when I have an epiphany sometimes, but I did driving home actually Thursday, because I think in the discussion, so I want to make two comments. In the discussion, if I remember correctly, there was a comment about an additional supervisor based on the number that you're supervising and what you should do. So one of the things that I was thinking about to propose to them with this additional nurse that they've asked for to cover the Mary Frances Wall Center, the Glenn Center, and the early college that's located at Rowan Cabarrus. If you think about it geographically, you've got here, here, and here. So it seems to me that, I mean, this is a proposal I would give to Dr. Pilkington. If they've got two supervisors and an assistant that's in this that they're asking for, if one is located at the Health Alliance building with the assistant, that's logical to me. Another one could ask the school system for a spot at the Mary Frances Wall Center so that they could be there to help those students, and they could also help supervise the ones in that part of the county. The new one could be located at the Glenn Center, ask for a room there. They could be there, they have a different time schedule. They could be there to help with those students, and they could, also help supervise kind of the middle section of the county, and the one up at the Health Alliance building could supervise there, and you would have the one assistant that could support all of them. Seems to me like they could, all of them are nurses, so if you're a supervisor, you're still a nurse, and it seems to me that that would be a better response than having one person driving around between 3 locations and 2 people or 3 people just up at that building. So seems like that would help, and it would also eliminate maybe in the future a request for another supervisor by putting them out into the area that they're serving. So that's one thought. The other thought on the 3% increase, we're not doing a 3% increase for anybody. And I don't know what they're doing at the Health Alliance, but we're not doing that in any here or anywhere else. So that money I would rather put over into, I cannot remember exactly how we phrased it, with the school system not knowing what the governor was going to do, we weren't going to fund that yet. We were going to hold it and wait and see what happens and then be able to make a move. So maybe for any salary increase, we would hold that separate and wait and see what truly happens, and then decide if the nurses would get the same increase or not, or what we wanted to do there. I don't know if I'm explaining that very well, but I hope that's logical to y'all.
That is correct. If you choose to fund the entire amount, we can hold that particular amount in your contingency that you can.
Mike, you said the lease rate that we pay at DHS or Human Services is $5 a foot.
I think it's up to, I'm reaching out here. I think it's like $650 maybe.
Yeah.
Does that sound right, Pam?
We can get that contract for them tomorrow.
Yeah, we'll get.
When they were there, though, it was in the $4 to $5 range, though, right? It's gone up since they've left.
Yeah, it has. Yeah, we've been there 15 years now. I think almost 15 years, and I started out in the $3 to $4 range, and it's had its escalations was it renewed.
What did they have there? About 30,000 square feet.
Oh, the health department.
Health Alliance. Yeah.
Yeah. That's about right. 20.
So we can get that also from reports.
Yeah, we'll get all that. Yeah.
I mean, if you're talking
It's a-
$5 a foot, which is the highest it was, and 30,000, that's $150,000. And this was the point that I was making to Dr. Pilkington the other day. Now, he said that he spent $7.1 million on that building, but this document shows $13.508, and he said it was $120 a foot, but at that cost, it's $225 a foot. And they exempt out that money that we pay for their building. They act like we don't fund that, and we do fund that. That's $1.5 million that the taxpayer of Cabarrus County is on the hook for, that goes for their decisions. And one of the things that I'm tired of seeing is these departments or entities make a decision that they would like to see their money spent on these glamorous facilities, and then when that doesn't work out for them in terms of the operations, they come back and stick the taxpayer with the bill. And I don't believe that we should do that. They made an agreement that they would take $300,000, that was one-time funding for Medicaid, and they can come and they can talk to me. But what they really need to say is their own management made a decision to build that facility there with a lot of things on it that they didn't need, and look at your management and talk to your management about the fact that they prioritized building these glamorous facilities over the people and the services that they could provide. And I think we've given them a whole lot more than what we've given them in the past. And if you take that $1.5 million and add it to what we're giving them and divide it on the per capita rate, we are more than fulfilling our obligation to pay $26 per capita. And I think we've done our duty.
If you look through the documents that we gave you, the very last page, we are giving them the 2566. The very last page of your handout, we have a historical schedule since 1998 when it was put together, and we're making it by like $1,000.
Yeah.
It's very good. We are funding them at the 2566 with the current contribution that they are receiving.
Yeah, so when you add that together, we meet our
That has nothing to
requirement.
do with the building.
Right.
Okay, so
This
if
is our
you,
cash contribution to them.
that $1.5 million we figured out was $8 a person. So
That's
we're
on top of
actually
that.
funding, you said 2566 is what this shows?
Yeah. Right there, the 2566, and we're $4,681 ahead.
Okay, so if it's 2566, we're actually funding them right now, and you add that $8 on, that means we're funding them total at a level of 3366, and that's well above what we had promised and what they said the deal was. So the people that work over there, I know that they will come and they will be upset at me, and that's okay. But they need to look through their own management and decide, you know what, you were the ones that sold us out when you built this building that we didn't need.
Well, if they only spent $7 million on the building, was all $13 million of it borrowed on those bonds?
It was a larger number. I believe the total amount on those bonds was $35 million.
Yeah, I know it.
Right.
$13 million was supposed to go toward the Health Alliance.
Yeah, I think
I thought it was $15 million when it first started out.
we asked for the breakdown. Have you got that entire breakdown of that $13 million?
Yeah, it was $13,502,662 that they received from the city of Kannapolis on the bond project. excuse me, $13,508,475. We have the financial statements from the City of Kannapolis where they have the capital project fund related to that debt financing. And then we also have the financial statement from the Health Alliance on the construction of the facility. And the actual building cost was $8.9 million if you round it. The land was $489,000. The architect was $592,000. Minor equipment and furniture was $1.3. Equipment over a certain cash level is $859,000. Legal fees were $131,000, and there were a couple of other incidental costs. They did get, I think, a $740,000 contribution from another agency that I think helped pay for some of the furniture and fixtures that were on that facility. But we were able to obtain these two documents so we can tell you all the different projects that were actually built with the TIF money, as we call it. It's really a COPS issue, but we, for some reason, like to continue to refer to that. And then we have the Health Alliance's financial statement showing what they did with that money that they received.
Well, one of my concerns is here, you've got them coming in here doing a presentation where they say they're getting $18 a person, and our records show they're getting $25.66 a person, plus this additional $8. You've got them doing a presentation where they say they built a building for $120 a foot, and we've got their own document and the City of Kannapolis' document showing that it costs $225 total expense. And you've got, as Chris mentioned, that they came in here and said we need $300,000 for Medicaid, and then they took that and they didn't use it for Medicaid and they used it on something else. And so you've got 3 examples here in the last week of when they haven't been honest with us, and I can't support I just don't think that it would be wise for us to give that entity more money.
Well, I thought the original agreement was if they did get their $300,000 back from the federal government, that they're going to get the $300,000 back to the county. Now, maybe I'm wrong, but it seemed like I remember that being said in one of the meetings. I know there's nothing said about spending it on school nurses.
I just know that we tried very hard last year to make sure that we took from the funds. We were funding 3 different ways school nurses. Some went through both school systems and some went direct, and we need to be able to track it better and make sure that that's where it was going. I think that's a vital program, and when there, if there is another hepatitis A or other concern in the community, they're the ones that go out and help. So I think that we should do the nurse. I think we should, if the nurse supervisors, administrative assistant, for whatever reason, were left out from last year, we need to cover that. If you want to add a nurse to cover those 3, I'm okay with that. If you don't want to add that this year and just cover the supervisors and administrative assistants so we can at least make that whole, I'm okay with that.
And we did shore up the Health Alliance. We thought we shored it up 2 years ago. Last year was when we did the extra hours and had the health insurance.
I'm sorry, you're correct. So 2 years ago, we tried to shore it up. All we have are the information that's been given to us. I think that we should make sure that the program is whole and that there's not, those are out there that were funded some other way. Pick those up. If you don't want to do the additional nurse, wait and we can see about adding somebody next year. If you don't want to do the salary increase, then we don't need to do that. I'm not completely sold on substitute nurses. So, but that's what I would say. At least we need to take care of the supervisors and the administrative assistant at a minimum, and the fringe, I guess, but $474. If you want to do something more, then say so.
Well, if my memory serves me correctly, was it within the past year that they had came back and made a request because they couldn't actually pay for the operating expenses of their building? It was about $90,000. I can't remember if it was a mid-year request or if it was during the budget that their power bill.
It was a utility question.
Utility bill.
It was about your utility bills, but I don't remember when it was, but there was a conversation about it.
I remember. And I remember we funded it. It was $90,000, I believe. They couldn't afford their utility bill.
During the time when they moved from their old location to the new, that first budget they were estimating because they didn't know.
Right.
And then I think it was last year's budget, I thought, where they were trying to true that up and have, since they had some history.
But they paid the county rent for their location, so whenever, at the old Kmart building, correct?
Yes.
And then whenever the county assumed the debt for the new building, they no longer pay rent. So they were going to use that money
That's correct.
that they were paying rent at the old Kmart building to us to pay for their
But
utilities.
weren't we giving them money to pay the rent?
No.
We were giving them money, but we didn't take it away from them when they moved out.
Okay.
We let them keep it
That's fine, I was just
in
trying-
exchange, as Mr. Meese was saying, in exchange that they got to keep that to pay the utility bills.
Right. But,
Which
I mean, I'm
was-
just saying, when they were there, that was trying to document exactly what was coming and going.
How much was that, do you recall?
Otherwise, we could have just not charged rent and not given them the money when they were there.
But it don't cover their utility bill now, whatever they were paying at the DSS.
No, sir, it did not. No. I don't believe so.
I thought that was a green built building. Supposed to be energy efficient and all that kind of stuff.
Well, you still have
It's
utilities when
much
you're
larger.
energy
Yeah.
efficient.
Do you want the
Much larger.
documentation on that rent? Okay, we'll go back and find that too.
I'm just going to, I mean, again, and I'll let it go. I think that we
And
need
was that
to.
rent?
We had a goal 2 years ago of getting this program correctly funded in one stream. Why this wasn't included, I have no idea, but I think that we should at least make sure that program is funded so that we can track it.
Well, we could.
And if you don't want to do, being addition, if you don't want to do an expansion part of it, then so be it. But I just think that we need to make sure we're tracking that correctly.
We could give the additional funds, and then next year they'll come back and the money was used for something else.
Now, if it's put in this line item, the whole point of that was to make sure it was in an item that could not be cut unless we cut it. So that, let's say that if we turned around and said, we want to reduce hours, instead of last year where we expanded an hour, that would be our decision. It would not be Dr. Pilkington's decision.
We gave that 300,000 of one-time funds last year, directed to pay for Medicaid. I mean, we can go back and look at the minutes, and it wasn't used for that.
No, I agree, but if she's saying that they funded it with Medicaid, they originally funded it with Medicaid, I don't know.
It can be moved around. I understand what
Yeah.
you're saying.
I just think that program, we need to line item it and make sure it's covered, and then if there's no expansion, there's no expansion, but at least cover what's actually there. And then Pam and Ann and Parth can track it and make sure what's actually there. And we know it's whole and it's complete.
If they're getting all that we promised them, and Pam says that they are in terms of that $25, why aren't they able to do these things?
As a clarification on the rent that Mr. Downs was talking about a little bit earlier, it is $694 per square foot right now for the Human Service Center. Without the taxes, with the taxes, it'd be $723. And as another clarification on the per capita calculation, when they calculated theirs, they backed out the school health nurses. That's how they're getting the $18.66. So it's that's how you can get that lesser amount. When you include it, which we have done, it's even above that. Thanks.
I mean, I find that this agency in particular, I don't want to be too broad, but, they come to us and they tell us the worst possible thing is going to happen if we don't get this funding, and then you find out that when you funded it, so the worst possible thing didn't happen, that they had the money to cover that, and these are going to other things, and I think that's Chris's point with respect to the Medicaid, and, I don't think that a lot of things have been accurately reported to us, and I think it's their responsibility to figure out how to make their own budget work. They built that building. We pay $1.5 million more for it now than what we were paying for it, and I think it's their responsibility to make their own budget work.
Any other comments or if anybody wants to make on? Yes, sir.
In the proposed budget, the new nurse is proposed. We only brought you these other figures just so you would have those figures. So we would need some direction. Do you want us to put the two nurse supervisors, or the funding for the two nurse supervisors? We have proposed $59,252. They are requesting.
Can you put this
additional money for a total of $339,952. That is not in the proposed budget. It's there for your consideration tonight. And we were hoping to get some direction so that we would have it in there, or a portion of it, or all of it, or none of it for the board, for your final approval on the 16th.
We can go in and adjust these numbers that we put up initially based on your desires, and then we'll know.
So you're going to send us a copy of this, is that correct?
Right.
Okay.
But-
We just need to,
We would prefer to have the decision tonight
Yeah.
if on these.
Right, but
on some of
even
these
in
larger
addition to
issues.
that.
Oh, yeah, sure.
You're gonna-
Yeah, after tonight, as we work on it and do our pluses and minuses and figure things out, then we'll have a copy and everybody will get that.
There was something about, he said the other day that if he didn't get the funds, he's gonna have to eliminate, what was it, 5 school nurses?
Or reduce.
I don't remember exactly what it was, but I know he's gonna eliminate some.
Is either
Correct.
reduce nurses or reduce the hours.
If he didn't get the $300,000.
Whenever we reduced the hours last year, is that?
We increased the hours
Yeah,
last year.
I'm sorry.
We added days and hours.
That's what I meant to say.
and
So
health
whenever we
insurance.
increased the hours last year in the budget process, that's something that we would have to cut. So how can he reduce hours, as you were saying about?
well, he's saying that the 2 nurse supervisors and the administrative assistant, in order to keep them, something in that, something's got to give. I think that's what he was saying.
But I thought the way you mentioned it earlier, with it being in line item, he can't reduce that.
He
That's something
doesn't,
we-
well, he doesn't have funding from us for the 2 nurse supervisors and the administrative assistant.
When we established the school nurse program, we thought 2 years ago we had every position,
Right,
and we didn't.
right,
We set up a separate funding line item for school nurses
right,
for the mere reason that it cannot be manipulated.
correct.
Those 2 supervisors and the administrative person were outside of that realm. They were in the general contribution we give them.
Right,
We're trying to get them back into the school nurse contribution.
correct. So there's
I
no
hate
way
saying
he
this out
can-
loud, but one other option is to take it from the general contribution and move it over to the school nurse contribution.
Which is what he said, if you do that, then he's got to cut something to make that happen.
But he can't cut 5 nurses since it's in the line item. So if that was a
He's
comment
going to cut
made-
something, I don't know. These people are employed, I'd like to just provide that funding, have it straight, and then let's go on.
I know, but I mean, if
Don't-
he's
I
saying
wouldn't
that if we
expand.
don't provide it, we're gonna have to cut, he will have to cut 5 nurses, but he can't do that since it's, is that correct?
Well, he can in order to pay for the 2 supervisors, because he can't have the nurses without the supervisors.
But that has to flow through your department, correct?
But the 2 nurse supervisors and the administrative person are being funded through his general contribution,
Right.
not through the school nurse contribution.
Right, which I understand.
So if we can get 218,000 more into his school nurse contribution, then he can't touch the nursing program. So you have an option of funding it as an additional money or taking it from his general contribution and transferring it over to the school nurse contribution.
Right. But Liz, you said earlier that he couldn't touch.
I understand. I guess what he's saying, I mean, I don't want to speak for him, but from what I'm inferring is that his intent would be to put these positions in that pot.
Correct.
So you have the same pot of money that now is going to cover the 3 other people.
Right.
And if the pot of money doesn't increase, then it won't go as far. It's 6 one way, half dozen the other. We worked very hard to get this done correctly 2 years ago. I don't know why it wasn't. It should have been, and this should have been in there 2 years ago. I don't know why.
And that was his decision to make at the time, not,
I don't know if the.
not to give you all the information. If there's
Yeah, I mean-
positions that was outside of that should have been included.
We
in that.
requested
Right.
all school nurse cost.
Exactly.
And, I mean, I'm not debating all of that. I just think that, I think we should just increase that pot of money and go on forward. I don't have a problem with just doing the nurses and the administrative assistant and that 474 fringe and call it a day and don't expand. We're not expanding anything else, but I mean, the idea, it was a nice idea to be able to cover the other 3 locations. Those 2 supervisors, nurse supervisors can probably
56.
cover those 3 at the same time that they're doing paperwork. I don't know exactly what they do, but that seems logical to me also, that they could cover those 3 locations and keep on going. I just was trying to get everything in one. So, you know, if I'm going to ask for funds, I'm going to ask for it all and hope I get some of it. So I think that's just kind of a normal thing to do. But that's my proposal, would be to fund the 2 nurse supervisors, administrative assistant, and the increase in fringe, and call it a day. We've got funds available to do it. I agree with all the arguments you're saying. I just think we need to set that one right, so we got everything in there and head on down the road, not look back at it.
So what you're proposing?
You need to, somebody else needs to chime in. I've made my point known. It's got to be at least 3 people to say to go with that line of thought, so they'll know what to do. That's what they're asking. So.
Well, I think Chris is right. I think there's absolutely no reason in the world that these positions weren't included when Pam asked for them 2 years ago. And the fact that it hasn't been remedied in the last 2 years, and that I don't think we even got notification of this request until the day of our meeting. I mean, we had something in the budget, and then they came back with these additional things. So this does not seem like it's a problem that happened 2 years ago. This seems like it's something that just popped up as a way to get funding, and we've got a lot of needs in this county, and the fact that the Board of Elections came up with $120,000, I think we have a lot better needs than to fund something for a department that has been a poor steward of the people's money.
Just wanted to clarify, they did submit a request a month or so ago, and we only recommended the 15. We recommended, per board's direction, that the 300,000 was a one-time cost, and then that would come back out, and then we were recommending the 1 position. So they did submit something about a month or so ago. We, as staff, only recommended the new position. So
the 59,000 was what you recommended?
that's what we had initially recommended.
No,
It was 56,928.
Because that was the salary we
they
thought
they
originally.
came, they came with their recommended budget in late March. At that time, they gave a 56,928 number. Since that time, as we also have on the county side many changes that occur with fringe, that's some of the changes that have happened with them, and that's why there's an increase. And of course, now they have a separate budget that they're presenting to their board. So these are some of the moving parts that are happening between late March up until, I guess, late May, early June now.
What are the PRN sub-nurses? What is that line? $39,000.
When one of the regular nurses is on vacation or sick, they call somebody in to fill in for them.
Uh-huh. I tend to agree with Chairman Poole. I think we need to, I'm not sure what has happened in the past or how we've gotten off track. I think he did offer some explanation as to some of the clinical services reimbursements that they were using for these purposes, and when clinical services were no longer funded, that funding went away, et cetera, and I'm sure we could do an exhaustive analysis of what they're coming up with, but I think for the school nurse program needs to be continued. I think it's valuable. So we need to do what we've got to do to fund it properly, which was our intention to start with. And so I would be in favor of doing those things. The additional, I do not have a problem with the additional nurse for those 3 special purpose schools either. And I do not, the salary increase piece of it, is that for all the nurses across the board, or I don't quite understand how that's broken down?
It's a merit increase potentially for 3.5% for those positions that are within the school nurse program. So I don't know if they took an average of what they might get, but that was like an allotment of funding for merit increases.
Right. I'd have to, in light of the fact that county employees are not receiving merit increases, I'm correct. That's not in the budget. I would not want to treat them differently. So I'm in favor of adding the 59 for the nurse for the 3 special purpose schools and the 2 supervisors and administrative assistant and the fringe.
Chris, do you want to say what you're for? Or?
Sure. Well, I think that the school nurse program is extremely valuable, and, we have, last year we increased the hours, increased the funding for that, and, so I certainly think it's a valuable program. The part that concerns me is that, Commissioner Morris mentioned that, there's, there's been some history behind it. Well, this is my 4th year, and so I've seen several different budget processes, and it really aggravates me how the money has been mismanaged and misrepresented. I mean, last year the one-time contribution of $300,000 was going to bring it all whole, and we were going to be able to move forward from that. Well, those funds were completely used for a different purpose, is what we were told, and the reason that they asked, those funds were just, it was just a total disregard for, I think, this commission board to ask for that one-time fund to bring them whole, and then they use the money for something else, and now they're still in a predicament. So I'm against any of the increase. I just can't justify giving additional funds to that department or to that agency whenever we were basically lied to last year.
Let me clarify. To restate what Pam said, the new additional nurse position that's currently in the proposed budget.
That's
okay,
the 56,000.
It's 59,252.
Okay.
56,928, I think, is what's already in there.
56,928.
This says 59,252.
The numbers change.
That number changed
Well,
from our
can I
original.
come up with some number? What is the decision on that position? Is there a desire to add that position or not add that position?
I don't have no problem adding that position.
Okay,
In favor of that?
Chris? That's that Wall Early College Glenn Center nurse position that would cover those 3 that are currently apparently not covered.
I have to think about that one.
I'll come right back to you. That we need to tell them so they can go forward with something.
The
That
deal was
position or not that position?
$300,000 one time, we're going to make you whole, and they won't live by it. And I'm saying we need to live by that. We funded that. They want more of that $300,000 back. They want that to be increased. And instead of being a one-time, that's going to be a recurring. So every year from now on, we're going to have that, so it's not even a one-time. So they need to live by the deal that was struck last year.
Okay, what they're asking for is one additional position, which is currently in the proposal. Do you want to expand and add an additional nursing position or not?
I want to keep the reduction of $300,000 that we agreed to last year. So
Okay.
I want to keep that. And it's amazing to me that last year they got $300,000 one time, and this year their additional request magically happens to be $339,000, right on the money.
I got that.
Yep.
What's proposed by staff is not the 300,000 however, to fund one additional
I
nurse
understand.
position.
I want no more than what was agreed to last year, which is that they would have that first $300,000 last year, and then one time only was $300,000, so I want a reduction of $300,000.
So that's what I just want
Yeah.
to make sure I'm hearing you. No additional nursing position is what you're
Right.
saying. Okay, fine. I just want to make sure I'm on that part. Okay.
Well, they may choose to expand additional school nurse programs.
Based on our funding of the school nursing positions, are we funding one additional nurse position? That's the question right now. Do you,
I say no.
okay. So I have a no for the new nurse, no for the new nurse, yes for the new nurse, yes for the new nurse?
I don't have a problem with it. It's not coming out of their budget, it's coming out of our budget, correct?
That's correct.
And it is needed. There's no nurse at those 3 locations.
That is correct.
But we got nurses at all the other locations.
That is correct.
So why don't we have any at those 3?
I think they asked for it, and we did not, because we were doing so much to make it whole before that we did not add a nurse for those schools, if I remember correctly.
Are they necessary at those 3
Well,
locations?
they would say yes. You've
How
got
many- how many-
pre-kindergarten that has accidents, you have high school students and high school students, so I'm sure they would say, I mean, based on their presentation, I don't want to speak for them, but
But that nurse
that's what
is
they've
gonna-
asked for.
That nurse is going to move between those 3 locations, correct?
That's my understanding.
How can that position be, if you got one person that's going from the Glenn Center to the early college to Mary Frances Wam, it's a pretty big distance to be traveling.
I would think they'd have posted hours and the schools start at different times and end at different times.
So if they're going to split
So
a
they
day
would-
up between
Or they'll
3.
do Mondays there at this one, Tuesday. I don't know what their schedule would be. We didn't ask them that.
So if you're a student and
So
you
I
got to
don't
get
know.
sick, you got to pick the day that the nurse is at the school.
Yeah.
Right.
Well, I mean, I wouldn't recommend funding 3 positions personally, so all I know is what they
I'm
asked
just trying to
for.
figure out how the position works. I don't understand that, so.
Yeah. It covers
Yeah.
three locations on some schedule.
But
It's going to be
is there any way to find out what the schedule's going to be? They going to make the schedule?
We can request it.
Yes.
I'd like to know that before I vote on it.
Okay, there's no direction for you tonight on what to do, so I don't know. I'd say leave the budget like it is, and we'll debate it again in 2 weeks. 'Cause
It's in the
there's
budget
no-
now, correct?
Yes, sir.
The one position is in there now. So we just leave it like it is, and we'll debate it again, because we're not moving anywhere, so might as well, 7:40, might as well go on. Is there anything else that you have tonight?
That was our list of the changes and the things that we have become aware of that needed adjusting.
We need some, in your 5-year plan, we have put in those salary adjustments based on the compensation study for the general services employees and for the administrative to bring them up to where we understood they should be. They are in the plan right now. We've not gotten any feedback, so we're requesting some feedback. If we don't hear anything, we'll leave them in there based on what we have currently proposed.
Anything else we need feedback on?
Okay, we'll go with that. If there's nothing right now, they'll leave it in there, and then we've got 2 weeks from now to talk again about any areas that anybody wants to talk about, so.
What's the amount of increase?
5-year plan.
$100,000.
How much?
It's $100,000.
Yeah, it was 100,000.
Pull up your 5-year plan.
That's not on here.
It's in the,
What page is it in the book?
that's what I was going to say, it's in the book on page 118, I think, let me see. Oh, that's scary, 118.
There's 2 items that we need direction on. One would be that salary item, to leave it in there. And then the second one is the workman's comp, moving that into your operating budget versus assigning fund balance to cover it. As you can remember earlier, 2 of the agenda items, one of those were freeing up some of that fund balance that had been assigned to cover some of the workman comp claims, or So that would free that up if you choose to go that route and use that money to fund, was that the Kannapolis?
Was the one, yeah,
That was
she
to
had
help
earlier
fund-
night, the Kannapolis architectural
Then-
cost.
Then that would take away that assigned fund balance, and then we are proposing to make those contributions to the general fund through the regular budget process.
So we have $1 million assigned right now, appropriated for that workman's comp.
2 million. Well, we had 2 million, and then we transferred 981, which left us 1,019,000.
Okay.
And then we were going to release that assignment with the institution of the workers' compensation to start being funded again.
If we have $1 million in that account right now, then why would we put that into our budget for next year? I mean, I thought we had just told all the people to come up that we were broke, really, that to come up with $2.8 million, we're going to have to cut all these services, and now we add $300 and something thousand. How much is it that we're going to put in? What's the contribution for workman's comp next year? Proposed?
300,000.
Yeah, so, I mean, 300 and 460, when we've got this $1 million sitting in the account, so why would we make that a general fund expense if we're as broke as we are, and to cut $2.8 million required the closure of all these things? I mean, that's almost 20% of that number.
I'll let you guys speak to the workman's comp, but I don't remember the word or the comment that the county was broke. What we're trying to do is...
We had that special
what
meeting,
we're
you'll
trying to
recall,
do
where to
is-
cut $2.8 million, we were going to have to close down multiple libraries and close down the parks and close, that was about $2.8 million, and now we're adding back in $300 and then $470,000 next year, when we have this $1 million sitting in a bank account that's
There was a
set aside to pay
suggestion-
for this.
There was, excuse me, I'm sorry. There was a suggestion that you were proposing, or that we were needing cash to help pay and free up some of that fund balance. Though that was fund balance that was assigned to workman's comp. I'll let them talk about why that we think it's necessary. We used to fund it through the general fund. We took it out because it was a fund balance was accumulating quite a bit of money. However, those claims are starting to come in at a more frequent rate. Now that's why we're trying to propose to move it into the general fund budget. So we know that it's going to be funded, and it frees up that $2 million that's been sitting in the fund balance as an insurance policy.
But we've got this money in savings to pay these claims. So what we did instead with this proposal is to start paying these out of the general fund balance, $300,000 and then $470,000, I think you said, next year, when we've got this balance in our bank account that's set aside. So why don't we take that money that's set aside, and when that dwindles down, then put it into the fund balance? So to move it in there this year seems very optional, and if we have the option of adding $300,000 to our general fund balance appropriations, that doesn't quite coincide with the presentation that was given just before the election, in my opinion.
I will let Ms. Wilson explain it to you, but at your last meeting, that $2 million was reduced to
1,019,000.
based on the approval of the board for those claims. So
And the workers' compensation for 300,000 and 460,000 was a part of that special presentation. Those numbers are not new. They were also part of that presentation when we had to make the reductions to meet the Plan E and Fs.
So we could have taken those out of our general fund appropriations during that presentation and saved $300,000 and then $460,000.
That option is available. That option was available at that point, yes.
Well, I think the bottom line is, as we look at the claims experience, it's about $760,000 per year. And in the past, we had intermittently put in fund balance to fund those claims. Well, we got below the recommended reserve, so we're like, okay, we need to fund something. Rather than coming back to you over and over and over, we figured, okay, what do we think is already out there where we're going to be getting claims here the last quarter of this fiscal year? We anticipated, if we put the 300 in next year and 460, because we knew we couldn't build, well, it would be difficult to build in $760,000 in 1 year in the base budget. and yet we wanted to get away from these intermittent uses of the fund balance, because by definition, you're assuming it's there, and those are costs we have to fund. And that's one area, too, where the state budget is not looking too good in terms of we might have a lot more workers' comp costs. So what we did was we basically backed into it. I looked and said, okay, for us to be at the right amount at the end of year 2, when I'm done getting my base built in, what do I need to put in now to cover the claim so that I don't have to come to you again for the money? And that was the magic 981 number. So that's how we came up with it. It's based on what the claims expectations are, and then what we had anticipated if we did this funding to build up to it instead of, it's easier to bite an elephant in 2 bites than 1 bite. So that's how we were trying to build that up. Does that help?
Thank you.
You have a presentation here of your Plan F. I think you should we should go forward with the way that that's presented at this point in time, unless somebody has a recommendation for a change. And that's what they're trying to find out. Do you want to change it? If you don't want to change it, we'll leave this like it is on 118 and take that into 2 weeks from now.
So is everything fairly stable with the exception of the Cabarrus Health Alliance decision? That's what's left.
I think you have to incorporate what you had, those changes that you've gotten since then. You have to incorporate those changes into it.
Right.
And give us a new version of this with those changes.
Most of those were fairly small. The largest by far was the Health Alliance.
I want to make sure I understand, as we have left it now, we are leaving the $59,000 in for the additional nurse, but we are not putting anything in, this is the Health Alliance, for the supervisor's administrative assistant. And those are the positions that he told us would, if they were not funded, would require either eliminating some nurses or cutting back on hours. Am I correct?
That's what he said. I think the argument is that that may or may not be the case.
Because he can't
So
do
I
that.
think you need to decide, does he fund those 2 positions outside of the school nurse budget or inside the school nurse budget? So what we're saying, if it stays like this, the way I interpret it, is that he will continue to fund those 2 nursing supervisors and the assistant outside of what we have said is the school nurse budget. That's what you're saying, isn't it? To stay like he is now, which is those that are funded outside of the school nurse budget.
Yeah, right.
But still with our funds, but in the other line item, is that what you're assuming? That he's not using Medicaid to supplement that?
That's what he has, well, I mean, he has to figure out how he's going to fund those 2 supervisors and the assistant. So he either funds it out of the general money that he gets from us or from another source. That's up to him to decide which way he's going to fund it, but that we're not increasing it in the school nurse budget. The school nurse budget, we're not funding 2 supervisors and an assistant.
Then he will reduce 5 nurses, or he'll reduce hours
Right.
to make that work.
'Cause I think his intention
That
is
is what he stated.
That is what he said, but I agree with Chris. I don't think he can touch that line item. I mean,
He can't touch that money, but he can reallocate what it's used for.
I think what he's saying is he would put that 218,000 that's funded outside, that he would put that inside and then take that much in nurses and
Make it go away.
make them go away. So technically, he's still spending what we have allocated for school nurses. It would just change in terms of the makeup of those dollars. Based on our conversations, that's what
concur with you, Ann.
I think he's saying.
That's clearly what he stated the other night when he was here.
Can I ask a separate question? We had, there was an Excel spreadsheet up that was showing all of our different funds. We had tabs across the bottom for 911 landfill arena,
Right.
that one. Can we look at, do each of those funds have an accumulated fund balance within them?
I don't,
There's no, that kind of information isn't up there, though.
Flip down to one time. Maybe the landfill. One of them I thought that, so
these are the budget amounts for the fiscal year 15 budget.
okay, will you flip one more, 911? Total fund changes. So that is just on a, that's our yearly funding. But I thought when I didn't get a chance to look at that very well when it was up there. But in the budget, it looks to me like those funds, when you look at our itemized funds inside the document, it looks like each of those funds has an assigned fund balance, not an assigned, an accumulated fund balance. And I understand with respect to the landfill that we are trying to get a fund balance there for purposes of closing it.
Right.
But I'm just curious if each of those other funds also has a fund balance and what that money would be used for. Because I think I remember looking at them and they were not insignificant. They weren't incredibly big, but they were something of substance.
I don't have that information right on me, but I can get it for you.
The audit would have it. The revenues and expenses for each fund are included in your budget books on pages 92, 93, 94, and 95, relating to each fund. The landfill fund would have some fund balance, but that's the reason we could eliminate the $300,000 that was in the general fund for landfill post-closure costs, because now that we can operate the landfill longer, we can make some more money there,
Yep.
and they can pay for those post-closure costs, is my understanding, which is why the $300,000 could be released. So that's with the landfill one. Arena and events. Think about fund balance.
Part of that fund balance is restricted for
By the CVB for
CVB
tourism
project
activities.
money. No, that's, excuse me, it's in a different fund. No, I don't think any of that money is restricted. The 911 fund would be restricted for 911 expenses.
Right, it's very restrictive. In fact, people across the state are begging for permission to spend them on a little broader category of things, because right now it is so restrictive what you can spend that on.
And the health insurance fund would be restricted for
The health
for the
insurance
claims,
fund would
with having
be
a reserve
for
balance in
those
it, so-
claims. So there may be some in the arena. I can check that. I can go back and look at the audit for 13.
That's the best place to
and
get it.
that's the best place to get balance sheet information. So if we took a break, I could go.
Okay. Any other comments? Anything else that anybody needs to bring forward? Okay, if you will look at the, oh, I've shuffled my things. Figure out where I put my agenda. If you'll look at the agenda for the regular meeting, please. There it is. Under consent, number 2, I'm not certain that we got full closure on paving versus not paving versus gravel. So I would like to move that to new business number 2. Number 3, I would like to move that to new business number 3. That would change the budget hearing and everything to number 4. Since that's kind of the main point of it, I'd like for that to be last under new business. Is there anything else under consent that anybody wants to move, or do you want to leave the rest of those under consent?
Chairman Poole, I believe that some of those finance-related agenda items were related to the budget, so I believe they should go after the budget.
Okay. Which ones specifically? Just to make sure we've got the right numbers.
I know,
The 125 and the 8.
So do you want to?
7, I believe, maybe.
5 and 7.
5 and 7.
5 and 7. Do you want to move 3 to after the budget? Or, no, I want to leave 3 before the budget, because that's 2 parts for me. 5 and 7? Is that what you said, Pam?
Yes, 5 and 7.
Okay, so you want to make 5 then under new business, and 7 would be 6 under new business?
Yes.
Okay. Anything else that anybody wants to move? Okay. Did you get that, Megan? Okay. So at this time, may I have a motion to approve the regular meeting agenda with those changes? To have a motion, is there a second? Second. There's a motion and a second. All those in favor say aye. Aye. Any opposed? Okay, if there's nothing else, may I have, is there anything else? No, ma'am. Okay. May I have a motion to adjourn? Motion and a second. All those in favor say aye. Aye. Any opposed? Okay, thank you all very much. Good night.